Hello, welcome to this module on communication. I'd like to start the module by acknowledging the traditional owners of the land we are on and pay my respects to any Aboriginal owners, elders, past or present. In this module, we're going to cover a number of learning objectives. First of all, we'll talk about the importance and role of communication in healthcare. We'll assess health literacy and how we might tailor our approach to health literacy. We'll discuss active listening in healthcare, the use of a technique called teachback to check that people have understood the information that we've given them, to discuss implementing health goals, also to describe self-management and how we can use problem solving to support self-management. Now, good communication is important because it helps us to ensure that the information we have about patients, the health information that we have about patients, is accurate. It allows us as health providers to understand the needs of patients and to plan their care. It also helps us to inform patients and families about their care and about their condition. And it encourages patients to participate in their care, and in particular, it encourages us to help them to manage their own care when they leave the service at home. Now, health literacy simply means the knowledge and skill that people have to manage their health and to stay healthy. Now, in Australia, a lot of people have insufficient health literacy, knowledge and skill to really maintain all aspects of their health. So people with low health literacy may have difficulty completing paperwork, for example, filling out health forms, or they may have difficulty navigating to other services, finding their way to other services. This can lead to delays in seeking care, so they can go to the doctor or nurse or health service too late when their problems already got quite severe. It also can mean that they're less likely to receive preventive care, things that would prevent them from getting sick, and less likely to ask questions. We can assess health literacy in a number of ways, and this can include just being alert to the fact that people might not be understanding. And then we can go on and seek to try and address health literacy, adjust how we talk to people and the care that we provide to fit with their level of literacy, their level of health literacy, not just language literacy, but health literacy. So we can do that by, first of all, using plain or non-medical language and avoiding jargon or acronyms, like an acronym for some forms of lung disease is COPD, which stands for chronic obstructive pulmonary disease. Now that's a lot of medical jargon and a lot of terms which many people wouldn't understand. So trying to use simple, plain language when talking to people is important. Trying to speak clearly and at moderate pace. If we speak very quickly, it can be very hard for people to follow. So speaking not too slowly, but slowly and clearly is important. Limiting information to just about 3 or at the most 5 key points. It's very hard for people to keep in their memory more than about 5 points at a time. So if we give them a whole list of things to do, particularly if we don't write it down for them, it can be very hard for people to remember and to understand. It is important to be specific, so not to be general. One of the problems, if we say to someone, for example, do more exercise, that's not very specific. People don't know exactly what sort of exercise we might be recommending that people have. And repeating the key points, so saying yes, and so at the end of our talk, we'll go through and summarize what are the main things that you need to remember. Drawing pictures and using illustrations or demonstrating with models can help. And supporting people to navigate services so that if they've got to go to another service, they're given some guidance about not just how to get there, but what to expect, and maybe even someone to accompany them to the service. So these are all ways that we can help people who don't have all of the levels of knowledge and skill that they need to maintain their health. Another important thing we can do is to actively listen to patients. Now, of course, we're all listening when patients tell us things, but active listening means that we're giving full attention and we're showing full attention. So we look at the person, show interest or concern, perhaps turn towards the person, and we make sounds or words to show that we're listening. We avoid interrupting, and we use open questions. So that means a closed question is, do you have a particular problem? Yes or no? That's a closed question. People can only say yes or no, or I don't know. Whereas saying, what kind of problem do you have, is an open question. People can talk about what their problem is and use their own words. They're not just answering yes or no. Now, teach back is a technique in which it's a very simple technique. It involves asking the person to say back in their own words what they've understood by what's just been told to them. So we might have talked to them about what medication they need to take or what exercise they need to do. And at the end of that, we might say, now I'd like you to just say back to me what you've understood by what we've just talked about. And that's important because it helps to tell us whether people have understood what's been said. It's not a test of the person. It's not like an exam. It's meant, if it's a test of anything, it's a test of how well we've explained things to the person. So it is important not to make the person feel like this is like a test of them, and if they can't do it, they'll fail the test and we'll be cranky with them. So it's simply a way of asking the person to say what they think, and it tells us a lot. And it may mean that we may need to go back over certain things. So an important activity that we do with patients often is helping them to set goals. So this might be a goal for doing more physical activity, or it might be a goal for eating differently, or whatever. Now, when we set goals for people, it's important that they are good goals, that they're goals that people can follow and achieve. So we talk about goals being SMART, and the SMART stands for these 5 words. So S is for specific, the M in SMART is for being measurable, the A is for it being achievable, the R is relevant, and the T is timely. And by that we mean a specific goal is one that is not general. So a non-specific goal, a goal that's not specific, would be to say something like, I want you to eat healthy food. Now that's very vague and general. It's very hard for someone to know what they should be achieving. Whereas a specific goal might be, I'll try to eat 5 portions of vegetables each day. So that would be a specific goal. And so it tells you how much is to be done, 5 portions, and also tells you how often, every day. That's pretty hard, I might add, eating 5 different portions of vegetables a day. But it's one of the goals that we have for healthy eating. So it needs to be, secondly, measurable. So we can record or measure how much of the goal is being achieved. Now, an example of a measurable goal is that I'm going to go for a walk at moderate pace. So that's being very specific, but the measurable part of it is for how long we're going for a walk. So how many minutes? So it might be 30 minutes a day. I'll go for a walk every day. And so if people don't achieve that, if they only go for 20 minutes, then that's okay, but that's not achieving their goal. It still might be good, but it might not be as good as if they got up to 30 minutes. So it needs to be achievable. There's no point in setting a goal that people simply can't do. So setting a goal like walking is usually achievable for most people, but for some people who are disabled or have got real limitations to their movement, they might not be achievable. They might have to do exercise in a sitting position for their exercise, for example. It needs to be relevant to them and their circumstances. So it needs to be something that fits with their life and their culture, and so on. So having an exercise which is appropriate for their own way of life. So going for a bike ride won't be relevant to a lot of people who don't have a bike, obviously. And it needs to be timely. It needs to be able to be achieved in a time before you're likely to be getting back to the person again. So those are how we set goals. We try to make them SMART, specific, measurable, achievable, relevant, and timely. And then when we review goals, when we talk to people again about, well, how have you gone with your eating 5 portions of vegetables, we don't criticize them and say, look, you only achieved your goal 1 day a week. Why couldn't you achieve it on the other goals? We say we need to understand what stopped them achieving that goal. So if we understand what stopped them, then we might be able to correct it. Or we might need to change the goals. We need to encourage people to try again. And it might be that they involve others. So often a problem, the reason people don't meet their goals is because things in their life, their family and their friends and workplace and so on, can make it hard. Some problem occurs and it's difficult for them to achieve their goal. And providing feedback or praise. So praising what's achieved rather than not what's achieved. So if someone only achieves their goal in 1 day a week, then praise that. That's great that you've achieved your goal for 1 day this week. How can we increase that to 2 days next week? That's the sort of way to talk to people about their goals. So this is the last slide, and it's about self-management and problem solving. So self-management is a big part of how we need to manage our health, and particularly for those people who've got long-term conditions or what are called chronic conditions. There's a big part of managing a condition like heart disease or diabetes that involves managing your behaviour, and risk factors. So things like diet and physical activity, not smoking, those sorts of things are a big part of managing your health in general, but in particular for people who've got a chronic disease. People with chronic conditions also need to monitor their condition. So someone with diabetes may need to not only watch their diet, but maybe need to measure their blood sugar levels with a little glucose monitor. Or someone with blood pressure may need to monitor their blood pressure. So this is different for every condition, but monitoring how you are going yourself as a patient is an important part of self-management. And of course, people need to follow treatment plans. So, for example, someone with asthma needs to know what the plan for their treatment is usually, so when they're in their usual condition, but also what to do if things suddenly get worse, if they suddenly have an attack of asthma and they can't breathe, what do they do? And they also need to know how to use health services, so when to go to the GP, when to go to the emergency department of the hospital. So those are all aspects of self-management. Now, the role of health professionals is to support people with their self-management. And an important part of supporting people with their health and with their managing their behaviour and monitoring their condition and following treatment is to solve problems. So there might be reasons why people haven't been able to follow their diet. So the first step in problem solving is identifying the problem. And it's not just knowing, for example, that someone doesn't follow their diet, but really trying to understand why they're not following the diet. It might be that they can't, the rest of the family doesn't go along with their diet plans. They want to eat a different kind of food, and that's very difficult for a person in a family to deal with. So once we understand the problem, we can try and think of ways to solve the problem. And when we're working with a patient to solve a problem, it's not just us coming up with solutions. It's very important that the patient comes up with some of the ideas themselves. Even if they're kind of a bit crazy ideas, it's okay. Getting a list of ideas is an important thing, and it's important that the person themselves thinks of some of the solutions. So helping them to think some of the solutions. So you have problems doing exercise because you don't have enough time. So how could we solve that problem? And the person then thinks, well, what could I do? Could I do shorter periods of exercise? Or how could I have more time to do enough exercise? And so really just trying to come up with as many ideas that might work, and then choosing one of them that they might try in the next little while, for a week or so, to see whether it works, and then reviewing whether it works. And if it doesn't, trying another way of solving the problem. So that's really the way in which problem solving can help. And it might mean enlisting other people in thinking about ideas of the problem and how it can be solved. But just trying one thing at a time usually is what's best, and seeing if that works. So it's a very simple thing, and most people are pretty good at solving their own problems. It's a little harder to help someone else to solve their problems. And the key thing is, it's not about telling people how to solve the problem. It's about helping them to figure out how to solve their own problems. Because if they figure it out, they'll be much more likely to make it work. So that brings us to the end of the module. When you've had a chance to look at the notes and now you've finished the module, you can do the quiz. Thank you.